In the heart of Central Texas, in an anonymous 7-story building, the laboratory at the Texas Department of State Health Services conducts millions of tests every year to help keep Texans safe and healthy. What kinds of tests? Let's begin with the tests performed on virtually every single child born in Texas. That's more than 1,000 babies every day. A drop of blood is taken from the heel of newborn babies and then sent to the Newborn Screening Program Lab.
In Texas, there's over 400,000 babies born each year, and in the Newborn Screening Program, we test each of those babies twice for 27 different disorders that cause developmental delays, mental retardation, and even early death. That's over 800,000 specimens a year, or somewhere between 2,000 and 3,000 specimens each day that we test here in the laboratory.
In November of 2006, Jessie Neal was born in Marshall, Texas. In early December, lab technicians screened Jessie's blood samples and detected a possible MCAD deficiency, a rare genetic disorder that, if left untreated, can cause sudden death. When a newborn screen is abnormal, the lab team sends the results to a case management team of nurses and public health technicians for immediate follow-up with a baby's pediatrician. All of this is done with a clear sense of urgency because, as in Jessie's case, acting quickly is often critical to a child's health. That's why the nurses and technicians are on the telephone the day they get results. The first step was to contact Jessie's pediatrician so he could contact Jessie's mother.
He said he has shown positive for a disorder called MCAD. And I said, and that means? He said, I don't know a lot about it. I'm going to find you a specialist right now. Just go wake him up and feed him and wait for me to call you back. So I hung up with him and I broke down, just flat broke down. And I called my mom crying that something was wrong with him and I was afraid he was going to die.
The MCAD disorder was found by pricking Jessie's heel at the hospital while he was just minutes old.
It never even occurred to me that that test would save his life.
MCAD babies do exhibit symptoms. However, they're subtle.
When he was first born, he slept a lot.
Jessie had a hard time waking up because his blood sugar was very low for his disorder. Just weeks before Jessie's blood samples arrived, the lab was testing for only 7 genetic disorders. But the Texas legislature wanted the program to conduct a broader set of tests. The day Jessie's blood samples arrived, December 7, 2006, was only the second day the lab had begun reporting results for MCAD.
If he'd have been born a week or two earlier, I think they'd have missed him. And if they did not catch him, his levels were so high he'd have died.
Hi.
But Jessie got a second chance.
He's such a joy. He's such a smart little boy. And even with all the doctor's visits, I was thinking about that earlier, I'd rather be with him in a doctor's office every day than not have him.
We expect our newborn screening program to give the 600 or more families that we have diagnosed this year alone, to give families a chance at a normal, healthy life without the burdens of the abnormal conditions that their babies would have suffered were it not for the newborn screening program.
Newborn screening is just part of the story. The state laboratory combines advanced technology and a skilled and dedicated staff who test more than 2 million samples each year. Samples of what? Drinking water, food, and clinical samples for infectious diseases like HIV/AIDS and TB, and animals for rabies. They test for the presence of uranium. They are charged with testing for chemical threat exposure, emerging diseases, and they would be center stage in the advent of a flu pandemic. Every day, the laboratory responds to hundreds of phone calls, emails, and faxes from across the state. The calls are from other labs, clinics, hospitals, and local officials who need to send samples in for testing. In fact, 6,500 samples of things like blood, water, food, soil, lead, and animal tissue come to the laboratory each day from all across this very large state.
Some samples like blood must be kept cold or even remain frozen during transit, while others like human tissue must be protected from the freezing process in order to produce accurate results.
Lots of things can go wrong in the specimen collection process. Improper collection, delays, improper storage, or even container breakage during transport can result in unusable specimens. So the lab provides training and packing and shipping instructions to ensure good results.
The Texas State Laboratory is one of the largest labs in the country, and with so many specimens coming in and the wide variety of them, it is so important and critical to keep track of each individual one. The staff then sorts them into categories, anywhere from animal heads for rabies testing to those minuscule parasites that are hiding in samples of food and tissue.
Every test sample coming to the DSHS lab is treated carefully, labeled, numbered, and routed to the right part of the lab for the test that's needed. More than 1 million test reports are sent out annually by mail, by fax, and encrypted electronic files. Diseases can come from almost anywhere. Invisible viruses in the air we breathe, parasites and bacteria in the water we drink or swim in, or in the food we eat. They can come from the genes we inherit, from a friend's handshake, a stranger's sneeze, the bite of an animal or insect, even from some of the products we buy. Lead, for example, can contaminate both our food and our water, so the lab checks many substances. Unsafe manufacturing practices can result in dangerous lead levels, even in pottery or candy. The lab also tests blood to identify children who have hazardous levels of lead in their bodies. Diseases like West Nile virus and rabies are transmitted from animals to humans. These diseases are monitored and detected by microbiologists in the lab. Rabies, which may infect many different kinds of animals, can only be detected in brain tissue taken from infected animals. Antibiotics have made it easier to treat many infectious diseases. However, diseases and the pathogens that cause them often have the capacity to change or mutate. The diagnostic tests the lab performs for these pathogens often help determine the appropriate medical care for individual patients.
It's the lab that determines, through the testing processes that we have in place, determine whether or not a case is resistant to certain medications or whether or not it's susceptible to certain medications. It tells us what we need to know about how to manage that TB patient. Without the laboratory, we are basically dead in the water because we have to use symptoms as the indication as to whether or not a person has tuberculosis. And by just checking symptoms, there's no way to determine if that person's disease is resistant or whether or not this is plain garden variety TB. So it's critical that we have a laboratory in place that can do those tests and do them quickly to assure to the practitioner, the physician, that he or she is providing the right medications, the right treatment for that particular case of TB.
Disease outbreaks such as flu, West Nile virus, or staph infections kickstart additional testing activity in the laboratory. If it's suspected that a disease outbreak is related to food, samples are quickly collected and shipped to the laboratory for analysis. Our Texas State Lab is connected through the National Centers for Disease Control and Prevention, a nationwide system. This system allows Texas to compare disease agents with those in other states to determine the connection between outbreaks in different parts of the United States. The lab also stands prepared to test substances in the advent of a biological or chemical terrorism threat. Some laboratory techniques have changed very little since the days of Louis Pasteur. However, the rapidly advancing field of molecular biology is helping the laboratory more rapidly and accurately analyze specimens and perform advanced genetic testing. The lab's electron microscope allows highly trained technicians to actually see viruses like herpes and flu. The 10 mass spectrometers the newborn screening program uses are truly remarkable state-of-the-art technology. Each machine is capable of conducting 500 specimen tests a day. In fact, the spectrometers can detect 20 of the 27 different disorders using a single drop of blood. This technology helps the lab run one of the largest newborn screening programs in the world. Of course, the lab is more than technology and equipment. The heart and soul of the lab is 400 or so microbiologists, chemists, doctors, medical technologists, specialists, and support staff who are dedicated to the health and safety of all Texans. They believe that whatever the disease or health threat that may face our state, the solution begins at the state's health laboratory.